Dr. Prue, is there any recent research that might talk to the benefits of mechanical devices such as the Modpod?
Yeah, I'm even going to take a step back. So, you know, a lot of people want to look at the latest and the greatest stuff, but, you know, don't forget to consider all the information that's already out there. And sometimes it takes a new look to look at some of the older types of research. So, you know, traction, distraction, decompression has been around for, 4,000 years. So it's not a new therapy. So it means that we have a long history of research, and there's some great history of research, and there's some not so great history of research. Part of that is, showing the benefits, and part of that is, showing that it has no benefit. So I think that when we take a new look at how we apply a particular therapy, we need to relive and look at some of the old research and decide whether or not that it's actually applicable. So if something shows that it wasn't beneficial, why was that? Was it because of the dose response, the length of time, the application, the device, the frequencies, all those sorts of things compared to, what we see today. So a couple of things. I think, a lot of the recent research in looking at the application of cervical distraction using a clinical-based system is important to show its benefit within a specific program. And that was a problem with old research where, we looked at a specific device, but that's not how we really did things in the clinical setting. Part of that is a mathematical issue, statistics, where, we have better statistics today. So it allows us to look at things a little bit differently and what we refer to as a multimodal or a multinodal approach to therapy. So it allows us to really mimic and research some of the things that we do in the clinical setting. So along with that too is what we're seeing in today's clinical outcomes-based research in certain countries where treatments are affected by reimbursement and policies and where the frequencies have changed dramatically. So when we look at some of the newer research that's out, again, that's a really big question that needs to be answered in terms of how does it apply to the way that you actually treat patients. Really recent is something that comes to mind by Julie Fritz's group, and doing comparative analysis between a clinical unit, so something that has the ability to manipulate the parameters, including creating a very specific and repeatable type of intermittent traction compared to the more home units or even static traction. And the significant difference was multiple. So it was a comparison between a home unit. So it wasn't just the fact of adding traction, it was adding a very specific form of traction and application of a clinical device. Improvement over just your standard, home style units. But also to look at the component of, if we add it to a regimen, does it enhance over and above, the exercise therapy, the education, and the manual therapy that we're also providing. And again, that study has done that, as well as, a multitude of studies, looking at from the benefits of adding traction even to a manual therapy, especially manipulation, and how it's not only not redundant, but it's complementary and shown to be more beneficial than if you do all of those other things without the use of cervical traction.